Good night, class. My name is Mario Lopez, and this is my week one video journal. So, the prompt is to answer a total of 4 questions. So, I'll go one by one now and explain what I think about each one. So, the first question is review the learning objectives for this course, and which are in the syllabus, and how do I feel they relate to my current and future role as an advanced practice nurse. So, I review the learning outcomes. They're not many, they're 5. So there were a lot of words like the objectives incorporate research into practice through critical appraisal and synthesis of the most current data. Develop, implement, and evaluate evidence-based solution to an identified problem. Demonstrate leadership and collaborate with other team members to evaluate and to improve clinical care. Incorporate ethical, cultural, legal, and spiritual and caring theories into doing this. So all these concepts, and I was just reading the main things in the objectives. All these concepts we've learned them since day one. And actually in our bachelor's also we learned these concepts for evidence-based and how healthcare is going to evidence-based practice to provide the best care that is cost-effective to all of our patients. I believe that the learning objectives for this course are clear, they're concise. We've been learning about this evidence-based practice. That's part of nursing, it's part of healthcare. So I think I believe this course will help us focus more and not only apply for this class, but also in the future roles in advanced practice registered nurses. Like I was saying before, the aim of the healthcare is to provide the best care based on evidence. That is the best treatment, health promotion, disease prevention. So number 2. Review the assignment descriptions posted in each week of the course and what questions or concerns do I have. So I went week by week. I had a concern in week 1 because we hadn't had a synchronous session or a meeting, and week 1 there was an assignment for logic model. I was not familiar with the logic model concept or I don't know, structure. So I emailed professor. He answered. After reading and researching a little bit what it is, it's pretty simple, but since I wasn't familiar with it, that was the concern. After that, I went week by week, and there are concepts that we all have taken. If we've taken a research class, you know about this. If you've taken a nursing research class like we did for this master program, we know about these concepts, about the SCOT analysis, the stakeholders, the methods and designs, and then ending up in week 8 with an evidence-based practice poster and our presentation. All these concepts, all these parts of our capstone, it's I think it's great that we're gonna focus on one item each week so we can go deeper and learn more about it, and it can help us develop and make better our capstone. So those are the main assignments that I could find. No questions in any of those. I guess once we get to that week, then we would look into it a little bit more. But overall, those concepts are not completely unfamiliar. I'm not completely unfamiliar with them because, like I said, if you're taking a nursing research class, you know about those concepts and you use them one way or another. You've heard of them. Okay, so question number 3. What am I looking to get out of this class? So first of all, and most of all, I want to graduate, right? So that's that's what the first thing comes to my mind. That this class would help me. That's the idea I had. That this class would help me to develop. We started the capstone project day 1 when we started this program, master program. Then we've been working on it, and personally, every research assignment that they've given us, I've done it on this so I could have more information, read about the same thing. My capstone is about type 2 diabetics in the Hispanic population, and how to use American Diabetes Association guidelines, and specifically individualized treatment for patients, especially Hispanics, in rural areas. So I think it's very important, these underserved populations, to provide the best care possible and to simplify, but individualize the patient care so we can succeed with these patients. So I hope that this class would help me identify and solve some of the issues that I've had with my capstone along this way. But the main thing that I hope to get out of this class is be able to finish my capstone, and have a little bit more guidance on some issues that I've had, as far as identifying relevant data and specific data, because data that's so specific. Besides that, I hope that this class teaches me, again, how to develop an evidence-based project, kind of refresh my memory and all of that. So whenever I am practicing in clinical practice, I will be able to do the same thing: do research, identify data, identify a problem, develop alternatives, better solutions, better mousetraps, and so we can improve our healthcare. I was part of the clinical practice. I've been a nurse RN for 5 years. I used to work in the intensive care unit. I was part of the clinical practice council, CPCC, which there was a group of nurses that would look into research in an intensive care unit, and would look at research and better alternatives for a bunch of stuff, for urinary catheters to central lines to stuff like that. So I really enjoy research. I really enjoy providing better care for our patients. So this class, I hope to kind of refresh everything that I've learned before, and just to create a project so I can continue doing it. I can continue teaching the same concepts to other nurses, to other advanced practice registered nurses. What experiences and expertise do I have that I feel that would contribute to the learning community in this course? So I believe that the experiences I've had, and all the challenges and all the learning lessons that I've had by developing this capstone. I've never done such a big project like this one, so long and with so many parts and so specific. I think all those lessons, all those late nights researching, kind of trying to look at, because it's not only the research, it's kind of knowing the concepts that they're asking you for, because sometimes you're not familiar with it. So I think all those challenges would help me overcome any other challenges that I face now. I see problems different now. I try to find solutions instead of just closing my head and not thinking outside the box. So what expertise do I feel that I have? I think a lot of I won't say expertise, but some skills that would help me or help anybody to learn better or to learn this type of community. Know where to research, know what type of information is valuable. Of course, writing techniques, APA format writing techniques, research, and identifying reliable sources. I think those are the key components to be able to develop a strong PICOT question, a strong capstone, a literature review, and be able to provide some alternatives to the problem we have identified. So overall, after reviewing the syllabus of this course and reviewing all the assignments and everything, all I can think of is I just want to finish. I am here. This is the last step, the last 8 weeks. This is week 1 where I believe all of our classmates are on the same page. Everybody's trying to finish. Everybody's trying to take the last steps. So far, I believe so far so good. I reviewed the syllabus. I look forward for the next weeks too, so I can complete all the other tasks. Like I said, I would have all the past assignments that I've done have been for my capstone. So I will continue. I'll put everything together. Hopefully, I will finish my capstone before the sooner the better. I would say so. I could. There's always a little things that you can improve, but so far so good. Thank you very much.